Hello, everyone. I'm Dr. Shawn Weiss and founder of Senior Health and Wellness Group, as well as owner of Select Home Care. And I'm so excited that you're joining us today for our educational series, where the topic is sleep over 50 and how to develop a great sleep plan. Super honored and thrilled to have our guest on today. We've worked together before, Dr. Catherine Darley, who is the founder of The Skilled Sleeper. She's also a internationally recognized expert in the field of sleep. So welcome, Dr. Darley. It's nice to see you again.
Thanks. So glad to be here. Everyone needs a
Awesome.
good night rest.
I absolutely agree. And let me tell you, as a healthcare professional for over 26 years and 20 of those years being in the field of senior health and primarily over 65, I still see a need in educating not just patients and healthcare providers, but the caregivers, their families, and the importance of having a balance, right? And the pillars of health. And one of the most important pillars of health to me that I work on is sleep. And I feel that in this population, it's kind of overlooked, and there's so many factors that go into their optimal wellness, and not understanding that sleep is a big component of that. So I would love it if you would kind of talk a little bit about why sleep is so important in optimal wellness, and then kind of what happens as we age, like over 50. Like I'm 54, I know my sleep has changed, and some of the things I do now, like that worked before, just kind of I've had to tweak over the years. So I would love it if you kind of give us a nice overview of why it is so critical to pay attention to the sleep.
Yeah, so sleep disorders are more common than a lot of other conditions that actually get more press, which is a little funny because every single person needs to sleep and we need to sleep on a daily basis, right? It's not something that
Right.
we can put off. And I think about the effects of sleep in 5 domains. That we have our physical health and our mental health. We have our physical performance like driving, safety, coordination, balance, and also our cognitive performance. How snappy are we remembering people's names and then the more complex problem solving. And the last piece is your emotional intelligence, how well you're able to get along with others, identify your own emotions, identify their emotions. And, really, it's a quality of life issue. If you want to have a good quality of life, you need to get the sleep.
Yeah, and I agree with you on that. And we share a lot of the same pillars. When I talk about sleep as one of my primary pillars, because it really does affect all of the other things. We talk about stress levels, activity levels, stress, exercise, nutrition, emotional health, all of those things are kind of wrapped up, and sleep can literally affect everything. So, with dealing with those over, 50, but especially over 65, what is changing in our bodies as we age, that's affecting our sleep?
There's absolutely some changes both to our sleep and to our circadian rhythm, which is those 24-hour patterns in functionality. If we look at the sleep pieces, a couple things happen. One of them is we end up having less deep sleep. There are 4 stages of sleep, and one of them is called deep sleep or stage 3 sleep. And if you look at stage 3 sleep, the brain waves are very high amplitude, very slow. It's also called slow wave sleep, and it gives us that sense of, oh my goodness, I slept so hard. I was so deeply asleep and out of it. But we have less deep sleep as we age. Fortunately, there's some things that we can do to promote deep sleep. Deep sleep is very important for physical repair. It helps clean the brain during deep sleep. The lymph system in the brain actually opens up and we can clear those metabolic waste products from the brain. That's very important for preventing Alzheimer's and cognitive decline. And then also we're using deep sleep to repair on the physical level. Deep sleep is when the majority of our growth hormone is secreted. So even as I'm just talking with my hands, Dr. Sean, little micro tears are happening. And when I'm in deep sleep tonight, growth hormone is going to come on board and help repair those micro tears. So even though we're not growing taller, we do
Okay.
need growth hormone. And with the decrease in deep sleep, we can start having advanced aging because of the changes there.
And we see that with physical therapy too, real quick, because that's one of the things that we talk about. And one of the first things I do when I do an initial assessment is talk about sleep, kind of get an idea of what their sleep patterns are and why that is so important in muscle function and muscle recovery, especially after surgery, or especially with decreased activity levels when we're trying to build strength, when we're trying to promote weight bearing activities. So critical. Yep, love that. Is there anything else in terms of, with circadian rhythms, like you said, and I've noticed that like for sure. Like I know that I don't get as deep a sleep as I used to. But I would say I would venture to almost the majority of the patients that I treat, which I do treat in a setting in home health where the
Okay.
majority of our clients are in a community setting. Maybe they're in assisted living, maybe they're in independent living, or maybe they are coming out of a skilled nursing facility. So maybe a little bit more frail, but we find great results and when we talk to the families, when we work on a plan, and then sleep is always included in that.
Mm,
And one of the things I wanted to ask you about is medication. So, there's a statistic that 83% of those between the ages of 60 and 79 are on at least one prescription medicine. And that's 53% for those, 40 to 59 years old. We see polypharmacy on a daily basis, especially your benzodiazepines, your Ativans, your Xanaxes, Valiums, especially in our cognitively impaired clients where that is kind of a daily intake. And I know that has a great effect on their sleep in terms of central nervous system, in terms of um, decreased amount of deep sleep. If you have clients that are on multiple medications, what do you talk to them about? Or because some of those you can't control, right? That's something that we may not be able to control, is the need for the medications.
yeah, so that the polypharmacy is definitely a concern in many different ways. We've got the drug-drug interactions potentially, especially if people are taking prescriptions from different providers, right?
Mhm.
The providers may not be checking for drug-drug interactions. They just may not know. And there's also nutrient medication interactions, which I think don't get the discussion they need. And in terms of sleep, one thing that we know is that when people can maintain their health and not develop chronic disease, that actually helps them sleep better. That some of the sleep disruption we see as people age and get into their senior years is because of the development of chronic disease. So we do want to prevent that, and we want to manage it and treat as best we can early on. The benzodiazepines, you're right, they definitely keep a person in the lighter stages of sleep. They end up getting more stage 1 sleep, more stage 2 sleep. They don't get the proper amounts of deep sleep or REM sleep, and that can have cause changes in their function in terms of the growth hormone that we talked about. But in
Yeah,
terms of REM is very important for learning, memory, cognitive function, emotional control. And so you could see some deficits in daytime experience in those areas if a person is on long-standing benzodiazepines, and longstanding benzodiazepine use is associated with increased risk of Alzheimer's disease. So,
absolutely.
um, yeah, we always like people to do behavioral practices for insomnia before using a prescription. And that said, sometimes prescriptions are just the right thing and they're
Yes.
necessary.
Yeah, and I agree with you on that. Sometimes it's exactly what is needed. But I often do feel that, that again, that behavioral changes and modifications could go play such a big role in not necessarily needing that medication, not understanding all the other variables that are contributing to sleep. So when we can't control the medication piece, then we're looking at controlling other things, right? Like making sure there's good nutritional intake, making sure that they have good activity levels, things that are going to promote better sleep in general, correct?
Absolutely. And I would also add to that list, getting proper light and darkness. That has a huge impact on strengthening our circadian system. When we are young, little kids, we are widely awake or we are deeply asleep.
That is so
And
true.
that is a sign of having a very strong, high amplitude circadian system. And as we age, our circadian system gets like we're a little bit awake, we're a little bit asleep, and it just kind of gets flatter and flatter as we get into our 80s, 90s.
So true.
But getting proper light and dark will really help increase the amplitude or maintain the amplitude of your circadian system. So you do feel more energetic and alert during the day, and you can sleep better at night.
That's so, so important. And we have clients who, they might be living still in their own home, or maybe they've had to move in with a family member, or maybe they've transitioned recently to, say, an assisted living community. And what we see, especially if we have people that have newly moved into a new environment, that's traumatic. It kind of changes their whole routine. So I think that that's a great opportunity for us to talk about a sleep plan, because we have seen that, especially since COVID. Folks want to age in place. They want to, make their environment as safe as possible. They want to maximize their independent function. And maybe they've moved in with a daughter or son, or again, maybe they've transitioned into senior communities. But with that comes a whole disruption of routine. So I think that's a good opportunity to go into your sleep plan. And like, if that happens, what are the areas that are most critical as we age to kind of hone in on?
Yeah, so you can find the sleep plan linked in the show notes. And the first aspect, which is hopefully fairly easy, is that you want to have a standard wake time. Your wake time actually has a bigger influence on how you sleep and your circadian system than having a standard bedtime. So you want your wake time to be within 30 minutes, the same across all days of the week. So that's the first part. And then when you wake up, go outside, get some bright light. When we wake up, our melatonin is still high. We have other hormone changes that just have us kind of be in a sleepy, drowsy state. But when we open our eyes, go outside, get bright morning sunlight, that helps switch our physiology into our waking, active, alert part of the day. And so we really need that strong 20 minutes, ideally outdoors. And depending on the weather and the climate where you are, there may be times of year that it's easier or more difficult to get that light. When it is warm enough, even if you need to put on a coat, have your coffee outside or do some exercise outside or have breakfast on the patio if it's warm out. Do really incorporate getting light in your lifestyle. And so 20 minutes during the morning, and then 10-minute bursts every couple hours throughout the day. If people are doing some kind of class in their community, whether it's an art class or a chair yoga or something,
Mhm.
if there's a patio and it's appropriate weather to do those outside, always choose outside when you can
Mhm.
during the day, just so that you get this strong signal that yes, it is day, time to be alert and active and performing at a high level.
Well, I know I see a lot of dark communities and dark rooms. And now, if you're in say, a senior living community, such as an assisted living, where maybe it's a little bit more difficult or you need assistance to get outside, is making sure the windows and the blinds are open. Is that enough light to expose yourself to, say, in the morning, versus if you're not able to get out right away?
Yeah, inside with the coatings on windows plus the overhang of the ceiling, it's really not ideal. It's certainly better than having the shades closed all the time. You definitely don't want to do that. We're really designed to be in sync with the natural world and the natural light dark cycle. So whatever you can do, and if it is, having asking for assistance to get out onto the patio, I encourage you to ask for that
Right.
help because that's going to promote your health long term.
That's a good point because I think it's you get into a habit or a routine, and what we do find in the senior communities is that do have pretty consistent wait times versus if I'm taking care of somebody that's in their own home or living with somebody where there might be a little bit more fluctuation or kind of leadway, to kind of sleeping in and doing what they want and things like that. So those are really really good points. In terms of if we could talk a little bit about food intake and meals, and how that can affect, either worsen our sleep chances or positively affect our night's sleep each day.
Yeah, that is a great question. So thinking of kind of continuing the conversation about circadian rhythms, we have circadian system in our brain, and that is really dependent on the light and dark cues. But we also have circadian systems throughout our body and circadian patterns, I should say, where our digestion is set to be on in the day and kind of at rest at night. So those systems in the body are actually helped and strengthened by having regular meal time. So again, you want each of your meals to start in about the same window, 30-minute window across all days of the week. So for instance, if you're having breakfast at 8, have it at 8 every day of the week. There could be a little bit of fluctuation, but not
Mhm.
a ton. Same for lunch, snack, dinner, have them in the same window. The other piece is that window in the evening before bed, 3 hours before bed, you want to not be having any meals and not have any alcohol either.
Mhm.
That you really want your metabolism to kind of have a chance to process your last meal, your dinner, before you get into bed.
You don't want that competing, right? You don't want your body is trying to set itself up for sleep. And if you are eating snacks 30 minutes before bed or taking an alcohol, then your body is going to have to work on that, right? Or those digestive processes instead of promoting a restful night's sleep. So I do the same thing when I'm coaching older adults and making sure because that's a huge problem. Like I have issues with that sometimes where I'm like, okay, I know I shouldn't do that, or that seems to be a big one is when to cut off the food, even small snacks in the evenings. And I find, I always do the kind of 2 hour rule, but you say 2 to 3 hours, and I think that that's ideal. And because I
Yeah.
notice a difference. I mean, it's a definitely immediate difference. And talk a little bit too, Dr. Darley, about how even one bad night's sleep can certainly affect us in the next day. And when we take care of a lot of people who have cognitive impairment, we are really trying to create routine, where we are really trying to promote good nutrition, good sleep practices. And what we find is, when somebody's more prone to, let's say, changes in their emotions, irritability levels, when they have cognitive impairment, of how crucial it is to have that routine, especially at nighttime.
Oh, it's absolutely essential. And we do see that sleep influences your emotional state. If you're not sleeping well, increase depression, anxiety, panic, irritability. So we do want people to get the sleep that they need every night. A nice routine for the hour or so before bed is to dim the lights. We talked about the importance of light in the morning, but you also kind of want to replicate sunset in your home by turning down the lights, maybe wearing blue blocking glasses if you're going to watch TV or something of that nature, just so that you're kind of replicating sunset for those 2 hours before bed. And you also don't want to be exercising rigorously. There is some actual benefit in the literature for doing yoga or Tai Chi
Mm-hmm.
during the day that can help with people's sleep. So that can be a really easy, accessible, fun activity to do in the evening. You know, if you want to stretch and move a bit, is to do some of those kinds of actions.
Yeah, it promotes relaxation. I find when I do my yoga stretching, I do that in the evening. Nothing that's getting my heart rate up too high, nothing that's going to start spiking cortisol, but something that is soothing where I'm working on my breaths and my stretching components too. So that's absolutely valuable. Can we talk a little bit about all the artificial light, whether that's from iPads, whether that's from our phones or the televisions? Um, Talk a little bit about how, as a society, that's becoming a huge, huge issue.
Yes, it's over 90%, probably over 95. Last I knew it was 93% of Americans who are on some kind of devices at night. And the thing with the devices is that they give off blue light. And if you look at natural light across the course of the day, it changes. The morning is much more blue, and that signals to our body it's morning, time to get into morning physiology. And then in the evening, and people know this from watching sunsets, it
Mhm,
shifts into more of the golden, reddish orange light. And when our eye is outside and we perceive that, it signals to our body it's nighttime is approaching, time to slow down. And if you look at people's heart rate, for instance, during sleep, it's much slower than during the day. Respiratory rate is slower, blood pressure is lower because we're really in this restful physiology. So what we're doing when we're getting all of this blue light at night from our devices is that we're signaling to our body, it's go time, it's morning, time to get going, time to be active. And
mhm.
no wonder we can't sleep. So, you know, I know, of course, and I mean, I do this because I'm, you know, in living in modern times.
Yeah.
Yeah, you know, it can be fun to watch TV. You're watching something interesting, it's engaging. So if you do want to be on your devices, encourage you to get some blue blocking glasses like these. What you're really looking for is you want lenses that are very reddish orange color because that's going to block the the right wavelength of blue light. So ideally, the recommendation actually is kind of shocking. People are supposed to be in dim yellowish light for 3 hours before bed. And I
Wow.
think for a lot of people, that's, yeah, it's pretty unrealistic
Yeah.
because we're still pretty active, but
Hmm.
at least 1 or 2 hours before bed, dimming the lights, wearing the blue blockers is
Where
ideal.
can you find those? I mean, is that something we can find on Amazon where you can find that quality of the red tint?
Yes, yes, you can. And there's a lot of different blue blockers out there for sleep. And for this time of day, you wouldn't want ones that have this yellow. Like this yellow is not enough for bedtime. Sometimes
Hmm.
people get these to just do computer work
Computer
during the
work.
day, but that's not sufficient. They really need to have that orangish red color.
Okay, that's a really good point. Thank you for pointing that out. And in terms of your healthy sleep lifestyle plan, Dr. Darley, can you talk again about, we're going to link that in the show notes too. So I want everybody to be able to have that. But as we get older, um, I think the things that we're talking about is so, so critical. And let's summarize again. You know, I think that having a routine is very important in terms of waking time, trying to get a standard bedtime, even though that might fluctuate a little bit more, making sure that our meals are timed appropriately, and making sure we're getting activity right? And then preferably outside, then we can kill two birds with one stone, right? Taking a walk,
Right.
getting outside for on the patio. You could do chair exercises. I often do chair yoga or exercises on the patios of some of our senior communities, just to
Hmm.
help them get exposure to light. And and then in terms of the medications, that's a big issue in the population that I take
Right.
care of making sure that we have everything else that we can control, any other variables that we can make adjustments to that might help compensate for some of the medication use too. So, is there anything else you can think of, Dr. Darley, from an older adult
I
standpoint?
Yeah, I would like to just touch on caffeine and
Yes,
alcohol. That
absolutely.
caffeine, one thing that people may not know is that our body's ability to process caffeine as we get older isn't as good as it was 20, 30 years ago. So you may get to the point where you're more sensitive to caffeine, and what you used to be able to take no problem and no problem with your sleep is now causing sleep problems. So what you can do is decrease the amount of caffeine or move it earlier in the day and say, no caffeine afternoon. The other thing is with this, that's also true with alcohol. What we
Mhm.
find with alcohol is if you take it right before bed, it will often help you fall to sleep. But once it's metabolized off in 3 to 4 hours, it's going to cause you to wake up. So you really do not want to have alcohol in the 3 hours before bed.
And it also causes an elevation in heart rate as well, too, right? As we try to
Hmm.
sleep. Yeah. And
Yeah.
I think that then in turn will help, prevent us from getting through those stages of sleep and getting into the deep sleep cycle, correct?
Right,
Yeah.
exactly.
Mhm.
Because alcohol, deep sleep is more prevalent in the first half of the night, and that's when the alcohol is going to disrupt your sleep the most.
Good point. Excellent point. Dr. Darley, you're amazing as always. And I'm looking forward to sharing this with our senior health and wellness group and all of our colleagues in the healthcare world. And it doesn't matter, like I said, I'm huge on prevention and wellness. And, even those over 50, of starting to take those steps right now and recognizing how we can promote optimal health. And that sleep is one of the most important pillars of optimal health. But then even as we get over 65, it's still time that you can make changes. And those are even small things that we talked about today can make a huge impact on our overall wellness. So I appreciate all of your feedback and all of your suggestions. And I'm sure that we're going to have you on again. I really appreciate the time.
Great, thank you. Sleep well, everyone.
Thank you, Dr. Darley.